Hi, Dr. Darren Roemhildt here today at Bridges Chiropractic Health Clinic, talking a little bit about flexion distraction. Flexion distraction is a mainstay treatment for a variety of spinal conditions that we treat, primarily for the lower back. We utilize the table that does the distraction, and it eases up on a lot of the pain that patients have. So to talk a little bit about what what we're really doing on the spine is we're taking the spine and we are flexing and distracting, or opening up the small joints here that will oftentimes be scarred and injured with trauma. Discs can also be affected there, and that will open those discal areas that are herniated or bulging, as well as just strain that can occur to that area of the spine that needs to have opening and closing because of the scarring that will occur there. So we'll see that with sprain strain injuries. We'll see that with discs that can push out and hit onto the nerves, and by opening we decompress and help to ease some of that stress that's on that bulging disc. And you will see that on a spinal model too that lays on the table, and as the table turns on, you will see how that can open as the table goes to the floor and comes back up, and it's a nice smooth distraction motion. There are other features of the table as well. Patients that can come in, maybe they're having sciatic pain from a pregnancy, you will see that the table can release downward, leaving room for the abdomen. Very helpful for that. And we see a variety of conditions with this. Disc herniations, disc bulging, sprain strains, an osteoporosis issue with the spine, to open the spine up nice and gently without a lot of forced treatment. Stenosis, huge, that really opens up that area of the spine as well as just run-of-the-mill sprain strain injuries that we see commonly that can tighten up the back, because when you tear and pull those ligaments, they will scar, and it needs that stretch to lay down the fibers along the lines of stress to open that up. So let's just show you a little bit what this looks like on a patient. So I'll have a patient lay on their stomach here, and we can turn the table on. The treatment typically isn't a long period of time because we don't want to overwork the tissues, but we want to make sure we get a good stress in. And so we can anchor on the downward stroke of the table, and when we do that, sometimes you'll feel the spine will actually cavitate and open up, and we're just gently anchoring the back up and down the spine to open up those specific areas of the spine that are compressed. Very gentle. Patients find a lot of relief with this, and this isn't a technique that's done very much in this area, so it's something that we pride ourselves here. We do a lot of this technique. We have multiple tables that do this, and it's extremely effective for a variety of back pain issues. So if you got back pain, we're here to help. Please look us up on Facebook or on the web, and this is the year to take back your health. Dr. Roemhildt signing off.